Hi everybody, my name's Clay Volkman. I'm the hearing provider here at Advantage Hearing and Audiology in Greensboro, North Carolina. And welcome today. Today we want to talk, our topic for a few minutes is going to be, do we always hear equally in both ears? Or does our hearing test results show that we hear the same, have the same hearing loss in both ears? And the answer to that question is no, we don't. It's not uncommon to test the left ear and the right ear and find out that they could be a little bit different in the hearing loss. Sometimes we may do a test and find out that one of the ears is perfectly normal. Let's say the left ear test and it's normal hearing. And then we test the right ear and there is some hearing loss in the right ear. Another situation is we could do the test and find there's hearing loss in both ears, but there's a different level of loss from ear to ear. I like to give this example just like when an eye doctor tests your eyes, they test your right eye, they test your left eye. You could have a different prescription in each lens. Then when they figure out what the end result in your prescription is, when they put both of those lenses together, hopefully it's going to help you see 20/20. They work together. The same rule applies in hearing. You can have a different loss in one ear than the other ear. And so if it got to the point where, a patient needed hearing aids, the one ear is programmed for a certain level, the other ear is programmed for a certain level. When they work together, our brain wants to hear with both ears. So when both hearing aids are doing their job and the brain is hearing with both ears, hopefully you're golden, you're hearing like you should be hearing, and everything's good. So when you have a hearing loss that's a little bit different from one ear to the other, it's usually referred to as an asymmetrical loss. So just for example, you could have, let's say you had a chart, an audiogram with the results on it, 20, the right ear at 20, okay, which would be considered like a mild loss. The left ear could be maybe at 40, which would be a moderate loss. So even having that asymmetry in the hearing loss, these are very correctable. They're not uncommon at all. A lot of people have these. And I'm just going to go over some of the common reasons sometimes why this happens. Some of the common causes is, in general, you can just be born that way. It's called congenital. It means from birth. Or a lot of hearing issues or hearing loss is hereditary. So it runs in your family just like any other thing that might run in your family. Hearing loss can be very hereditary, and it can be corrected in most cases. So another example may be somebody that's an avid sportsman. He likes to hunt. He shoots a gun a lot, so naturally he's going to hold that gun on one side of his head and his shoulders. So that ear may be being affected by loud, gunshot noise, over a period of time. That may cause, a different loss from ear to ear. And just another similar one, maybe somebody that drives a truck for a living and gets that constant motor engine noise. They have their window down, maybe it's lopsided and it's gone on for a long time. The hearing loss may, be a little bit different from ear to ear. Okay, so those are just some common causes that may cause it. In general, there's, different ones. I'm just kind of pointing out a few. Some of the uncommon causes when we see an asymmetry, a difference from ear to ear, may be something more serious like a vestibular tumor. It could be a benign tumor, but it could be growing on one side and not the other side. The same thing could be like an intracranial tumor. It's growing, it could be benign, and we hope it is, but the hearing results are going to show that, and then what we do is look deeper into it. So it could be growing on one side, maybe putting some pressure, causing a slight loss, on that one side of your, in that ear. In some cases, when an asymmetrical loss is shown on a hearing test, it may be the only indicator, and this is why it's so important, to have your hearing tested. You may not have any other symptom. It may be the only indicator for one of the two, or there's other reasons mentioned, like a tumor, hopefully benign. If it's growing there, this may be the only indicator that something like that is going on. So just real important, just keep it simple. Don't want to scare anybody. Some other causes could be, we all have viruses throughout our life, the flu. It could attack one ear over the other ear. When that happens, it could be, it could have long-term effects, or it could just have an effect while the flu is going on. And, sinuses, pressure, all that kind of stuff kind of factors into it. Another consideration, there are over 250 medicines that are considered ototoxic. Some examples of those would be people that are on chemo. The medication they take can affect the hearing organisms. Even a medication as simple as ibuprofen, taken in too high a doses for a long period of time, can affect one or both of the cochleas in your hearing. So those are just some of the causes, that could affect and make your hearing seem like you have different hearing loss in one ear from the other. I just want to kind of generally tell you there are a couple types of hearing loss. The first and most common being, it's called sensorineural hearing loss. Each cochlea behind your eardrum has 30,000 little nerve endings in it, and over your entire life, those nerve endings, all sound goes across those nerve endings that sends sound signals to our brain. From birth, those nerve endings are picking up sounds, and when they get weak, it could be from noise exposure, it could be hereditary. It's the most common type of hearing loss and the most correctable. So sensorineural hearing losses, which is in the inner ear, very correctable with hearing aids. The second kind is called conductive. Conductive loss is when there's something going on in the outer ear, like our actual outer ear or the middle ear, which is right past the eardrum. It has 3 tiny little bones in there that want to make a hammering motion. And when there's a conductive loss, sometimes there's a lot of reasons for conductive loss, but a conductive loss is something preventing sound from getting to the inner ear, that cochlea I was just talking about. So if somebody has a trauma to the head, if something as simple as a wax buildup is considered a conductive loss. It's in the outer part of the ear, but it's blocking sound going into the ear. So, and then the third one is a mixture. You can have a little bit of the sensorineural loss with the little nerves that are sending this sound signal to your brain, and you could have a conductive component that is blocking sound from getting in, to your sensorineural and sending the full signal up to your brain. So the first step in determining any of this or any loss at all is to schedule a free hearing test. And we are here Monday through Friday, 8 to 5. we'd love to hear from you. So I honestly believe that what's it going to hurt? Just find out where you're at. If your hearing is fine, if you have normal hearing, we're going to tell you you have normal hearing. We'd love to see you back like once a year and just keep an eye on it in case at some point something happens and it changes. So in summary today, sorry, my voice gets a little dry. Most of us want to live a very active, healthy lifestyle, and we want to do that to the fullest. So addressing and early detection of any kind of hearing loss or any hearing issues is just paramount to helping you hear the best you can hear for the rest of your life. Okay, so I already said it. I'm going to give you our phone number, but we'd love for you to give us a call. And our number here in Greensboro is 336-271-4944. And I hope everybody gets out and enjoys this beautiful fall day. And I hope everyone has a great day. All right, thanks.